everybody here before, but the reason we start in a group like this is very simple. You know, the initial information does pertain to everyone. What I'll be showing here tonight are both normal and abnormal x-rays on the view box. They're not your x-rays yet. What they are patients of ours who have given us permission to show you. So when we break it privately, we're going to go through yours, and it should really stand out to you. You should know exactly what you're looking at, how it affects your health, where the things that might have brought you in are caused, and that way you can really see how it will be changed or corrected. I will tell you, even though we see people for all sorts of things to improve their health, still the top 3 reasons that somebody seeks out chiropractic treatment in our office are all pain related. You know, headaches, neck pain, and back pain are the top 3 things that somebody walks in the door for, yet many people are surprised when they sleep better or breathe better or their blood pressure drops, or these things that are beyond just pain, but actually when you influence the nerve system, it can affect so many positive things. I will tell you, we don't just see it in our office consistently, but the very first time that I ever went to a chiropractor, it wasn't for pain, it was actually for asthma. Not asthma I'd had forever, but asthma that I developed after I was in a weightlifting accident. I grew up in Freeport, I was at the Freeport YMCA, had a friend of mine drop a weight bar right here, 125-pound bar, came about 3 feet down, hit here, broke 7 bones in my face. You can imagine bounced. I have a scar here in my forehead. The next part is pretty telling. Went in an ambulance. Within a week, I had titanium through the entire left side of my face, and a plastic surgeon spent about 6 to 6.5 hours just trying to make that look normal. One thing I always say is, I think you did a pretty good job. Never had anybody notice. This is all fake. It's all reconstructed. And actually, it didn't take that long. It took about 3 weeks to look okay, to feel okay. The scars faded, the bruise healed. And so I actually considered myself lucky, because I thought I'll never have another issue. I'll just have the titanium, and it'll be fine. And I didn't for a while. It took about 4 months, but like I mentioned, I had that first asthma attack. Now, I did what most people would do. I went to the doctor. I got asthma meds, covered up my breathing. I was able to play sports, no issues. Went from asthma to very significant allergies, and just started to have these issues that I'd never had before. And so I wasn't necessarily satisfied with that, so I started to go see several doctors, which then turned into specialists. 11 specialists later, I had a couple different medications which took care of every symptom that I had, but it just never fixed it. In fact, they told me I'd probably be on them forever, for the rest of my life. And so it was actually the 12th different doctor that I went to see was the very first chiropractor. And like all of you would have had, I had x-rays of my spine, but the main focus, they told me, was this curve, this side view of the neck. And as you can see, the normal 45-degree curve, from that accident, my neck actually had reversed. It had gone to -11 the very first time I ever had an x-ray. Yet even though that injury was very significant, it took 4 months for all that pressure to sit there before I felt it. More than 8 months before I even had a twinge of any sort of discomfort or pain. Now, some people that are sitting here tonight, they know they were in a car accident, they fell on the ice, they had something that just triggered it, caused the pain or the issue to start. But for most people, it's not one thing, it's a bunch of small things. It's their job or their hobbies or things that wear on them until finally they start to have an issue. And now, every person, you get to make your own choice on your health care. I think everybody knows that anyway. But if you think about it, we have the best ranked medical system in the entire world, best prescription availability, life-saving technology, all these things. But we also have the most chronic diseases of any country in the world, which means we take the most drugs, we have the most prescription consumption, we take by far the most painkillers. And so, truly a pill can make you feel better. If you're going to fix it, you have to really look at doing something potentially a little bit different. Now, to go back, before I talk too philosophical here, if you are hurting, your back hurts, your neck hurts, your head hurts, believe me, that's the first thing. Everybody deserves to feel better. But beyond that, if you really talk about being healthy, in a dictionary, they'll talk about your body's ability to heal and function is really how you can judge your health. 100% is perfect. 0% would be death. For you to have pain or some sort of health issue, before you'll even get the symptom, before you'll feel it in any way, whether that's blood pressure, tension, any of those, acid reflux, just to get a symptom, on average it's 60% function or 40% loss before you feel it. And think about really any major disease that we worry about. Heart disease, you don't feel the artery plaquing. It takes years, if not decades, for enough plaque to get an artery to have a heart attack. You don't feel cancer growing. You don't feel your blood sugar rising. Typically, somebody's diagnosed diabetic either on a test or after their blood sugar skyrockets. You don't feel that until very late stages. Well, just like you don't feel those major things, you don't feel arthritis starting. You don't feel your spine shifting out of place or scoliosis growing. You don't feel a disc bulging. You typically feel it after it's gone from here all the way to somewhere over here before you're going to feel that. And so when you come in here, many people feel better after their first adjustment. Within their first several, everybody starts to get these improvements. But really, truly, what we talk about is spinal correction. So I care about getting to here, but I care more about getting as close to there as physically possible, because again, if you think about it, if you stop when you start to feel better, you'll keep the same job, lifestyle, hobbies, and it won't take that long for it to go back. But instead, as you continue to correct it, if we change the shape of your spine, if we really improve your overall health, it's going to be much more of a long-term correction and truly keep the health that you're gaining. And so that's why when we take your x-rays, although we care about what the spine looks like, we care about what it affects. I think everybody sitting there knows your brain sends messages right down the spinal cord, out the nerves, telling your heart to beat, your lungs to breathe, your stomach to digest. Think about if somebody cuts all the nerves going to your heart, wouldn't live very long. Now, incredibly rare to cut the nerves, not uncommon to pinch a nerve in your neck. People feel that all the time. Their neck hurts. They hold their stress up here. Their arms or their hands might go numb or tingling. But the same nerves that cause all those pain symptoms, that's right where the nerves exit your spine and tell your heart how fast or how strongly to beat. The same nerves go to your lungs. They affect your breathing, cause things like asthma. Middle of the neck, they cause neck pain, of course, but they go to your thyroid. They affect your metabolism or your energy levels. This top part of the neck, headaches, migraines, sinus problems, inner ear like ringing or dizziness. The same nerves affect your sleep, specifically the REM sleep, and these nerves affect your mood, the serotonin release, which can affect anxiety or depression type symptoms. I normally don't tell this story, but if you saw in the news recently, Jim McMahon, the famous Bears Super Bowl quarterback, is known for suicidal thinking, depression, a lot of these things that are becoming more enlightened from all the NFL head injury cases. Well, they came out with a story this week that he had a seated MRI, which showed that his top bone in his neck was out of place, and it was causing his spinal fluid to pool, which was causing severe pressure on his neck, and actually his neurologist told him that he should get adjusted. And so even with the first adjustment, he felt it was like this flush, and he's not perfect yet, but he started to feel those symptoms already disappear. If you think about, he has the best availability to all medicine. He's been looking for an answer for 12 years, and it was a seated MRI that found this, and he went to a chiropractor and got adjusted. He felt better than he has in more than a decade. Middle part of the back here, these nerves go to the stomach, things like reflux or indigestion, pancreas, which can affect your insulin, liver, gallbladder, and spleen. The lowest part of the back, these nerves are actually the most common area if you do develop pain as somebody ages. The low back is where you get the most wear and tear, but also the bottom 5 nerves, they branch down into your legs, so the nerve called the sciatic. I bet most people in here have heard of the sciatic nerve before, sciatic nerve pain. But also remember, these nerves go to the intestines, the reproductive organs, and can affect all sorts of dysfunction, but also adrenals, kidneys, bladder, and ferment the prostate. Now, like I said, anywhere you pinch a nerve, of course you can feel pain, but only 10% of your nerves are sensory. Only 10% of the nerves pick up or feel pain. So you could have a pinched nerve and you could have terrible neck pain. But you could also have a pinched nerve and it can affect your breathing or your stomach or wherever that nerve might be, and you may have no pain whatsoever. And so that's why when you come in here, of course if you're hurting, we focus on that area, but beyond that, anywhere that there's any dysfunction, we work on that to help the body function better. In fact, I've asked this several times. I've said, does that not make sense to anybody? I've never had somebody tell me it didn't, but I have had people say, well, then why did my last chiropractor just have me come back when it hurt? Or how come I've been to several doctors without near as much of an answer here? But what I'll show you, every doctor, pediatrician, orthopedist understands this at least at some level. Again, the spine has to be straight from the front, 45-degree curves from the side. This surrounds and protects the brainstem, the spinal cord, and all these individual nerves. If you lose this curve, it makes it very easy for your spine to shift. Everybody see what that would do to these nerves right here? That pinching or that pressure, that will affect wherever those nerves go. Take this to an extreme. I would bet most of the people in this room have heard of scoliosis. It's a scoliosis. Why does somebody with scoliosis have negative health problems? It's not the bones, it's what the bones protect. Everybody see that? 20 degrees is a medically diagnosable scoliosis. Over 40 is when they put rods in your back. And they're called stability rods because they've shown that over 40 it will get worse every year, and it could actually pinch these so bad that the rods are considered life-saving. But again, they're not overly successful, so it's not one of those things that you want to have done unless you absolutely have to. Now, the reason why we take an x-ray more than anything is because I can guarantee you can't tell what somebody's health is just by looking at them. If you looked around the room today, you couldn't pick what person deals with what issue. And so that's why, the last 15 minutes or so here, we'll go through these normal and abnormal x-rays. We'll start right at the top. This is a perfect 45-degree curve. Teeth are there, back of the skull is right there. Neurologists call that curve the arc of life, most important curve in the spine. Now, the reason that this is the most important curve is actually right in this top part of the x-ray here. It's closest to your brain. So for your brain to send a signal to your big toe, to your colon, to your heart, the majority of the signals go right through here. Does everybody remember Christopher Reeve? Remember what happened to him? Horseback riding accident, landed chin first, broke his neck. If you read his book, they say the damage was so slight, you could cover it with the tip of your pinky finger. Yet that paralyzed him. But beyond that, beyond being in the wheelchair, he had to have a pacemaker for his heart, a respirator for the lungs, feeding tube into the stomach, and they cut a hole in his colon, and every day you'd have to have a nurse push on his colon, and he'd go to the bathroom in a colostomy bag. Yet when they did the autopsy, they said that there was actually nothing wrong with his colon or the nerves that went to it, or the stomach, or the heart, or the lungs. The fracture bruised his spinal cord enough that it decreased the signals going down, and he couldn't control his organs well enough without all those medical interventions. And so that's why even if somebody comes in with a low back issue or a mid back issue, we still look at the neck because it can affect how the signals go everywhere else. If you look at the spaces between the bones, those are called disc spaces. Most people have heard of bulged or herniated disc before. Discs feel absolutely nothing, but the nerve comes out right behind where the disc is, in between the vertebrae and your spine. This top bone has to be parallel to the skull, even spacing, surrounds and protects the brainstem. That's normal. When we look at your x-rays tonight, we'll tell you one of 4 phases of degeneration. Phase 1 is any shift outside of the norm, any shift that would start to cause a health problem or a health issue. Phase 2 is when it's been there long enough that you can actually see the spine starting to deteriorate, bone spurs or disc thinning. Now, in this position, it's been there for 10 years or more just to be able to see that. What I think is most unique or dynamic about your body is even if you're in phase 2, and of course if you're in phase 1, that is 100% correctable. Full correction is possible and expected. Phase 3 still gets really great results. 70 to 80% improvement on average. That's with the bones themselves being deteriorated, multiple thinning discs, 20 to 40 years to get to this point, and you'll still do great. You'll have huge improvements. The only phase that's not correctable is phase 4, and I will tell you not one person sitting here is in phase 4. Phase 4 is if you were to look at this, you can see all the spaces here. Every one of these vertebrae you'd see degeneration through. 5 to 6 segments at a time, just completely degenerated, fusing through here. And you can imagine if your whole neck was fused, or your whole mid-back was fused, think of what those nerves would be able to do for your body. Does that make sense to everybody? So, here's some comparables. Joe, this is Sarah. If you look here, you should be able to see the differences as a progressive loss. See how this starts to lose the curve? It's about halfway lost or about a third. Actually, it's slightly reversed right there. So now, one of the reasons that I show these 3 people specifically is that actually she has no symptoms.